Hello, everybody. Welcome to the Informed Mom Podcast. This is Jessica, and I'm here with my co host, Angie. And our guest for today is Dr. Elena Rumack. She is a pediatric dentist, and we'll be covering a large range of topics today to address your child's dental care. And before we do that, though, we always start our every episode where we celebrate an individual little mom win and a mom fail. The whole point is to celebrate the ups and downs of motherhood because we're all going through something and nobody's perfect. And let's just talk about it and normalize it. So, Andy, why don't you start us off?
Yeah, so my family, we are purchasing our first home in the Lake Arrowhead area, and we're really excited about that. So that's the huge win for the whole family. And we've been talking to our 2-year-old about it. And so far, he's just like, yeah, we're going to the new house with a lake and adjusting really well. So I'm happy that he's not stressed out by it and that it's kind of an exciting thing. My fail is probably that, something changed for him at like 2.5-ish. He's not quite there yet, but he's just so much more independent and outspoken, and he wants things just exactly the way that he wants them. And so when it's 8 o'clock and he's not asleep yet, and he's like, I need to go on the potty for the 9 millionth time. I'm just so done and tired and frustrated at that point. And I can't say I have been coping the best.
Totally understandable. I hear you. What about you, Dr. Rumack?
Well, actually, I have a win and a fail at the same time, if that's possible.
Yeah, totally.
Talking about 2-year-old being independent. I have a 17-year-old who's not very independent, and he just went off to a summer college program, pre-college program for 3 weeks, and he was really excited. He called me last week. It's been like a week and a half. He says, "Mom, for the first time, I did my laundry."
Aw.
Oh, that's great. That's funny. That's a win. You're learning something new. And then at the same time, I was like, oh my God, my kid is 17 and he hasn't done laundry before. So I just feel like, in a ways, like we try to do so much for them. And, sometimes we, just are doing too much for them, and they just kind of don't learn not to, be very independent. And so they slowly learn, eventually. But I just thought, oh my gosh, it's kind of embarrassing that it's, this is his first time doing his laundry at 17. So that was a little bit of a fail. Maybe we should have given him more, liberty to, do his own thing and, be more self-efficient in life.
Maybe this is embarrassing, but I didn't do my laundry until college.
Good.
My best friend was doing, like, I remember we were in 5th grade and she was sorting the colors and the whites, and she was doing her own laundry and stuff. And so there's different strokes for different folks, and however we want to parent, or however we were parented. And I turned out okay, so I'm sure.
Yeah.
It's okay.
I work with so many teens, and I follow them as they get into college too, and still work with them, and they all are in the same boat. So I don't think you're like, out there on your own. This is pretty cool.
Okay.
Yeah.
Okay, good.
Yeah.
Awesome. My win is that Hunter had his first sleepover at the grandparents. Yeah, it was so awesome. We got a chance, like David and I went scuba diving, we went to dinners, we did all this stuff, and he had a great time at Grandma and Grandpa's. My fail is when he came back, he wasn't that excited to see me. I mean, normally I am like his world, and I savor that. And he was just kind of like, well, where's Grandpa? And I was kind of like a little bit hurt by that. Maybe that's not a big fail, but it really stuck with me. I was like, wait a minute, what am I, chopped liver? So it's like positive, because I want this to be like a regular thing. I really like having that kind of fun freedom, but at the same time, I still want to be needed.
He needs you, trust me.
Oh, yes.
It was just a little bit of a transition adjustment, probably, of him trying to understand the timing of everything, right? Like those little brains. Figure that out. So
So let's get started with pediatric dentistry, shall we?
Yeah.
I'm so excited about this episode. We had Dr. Rumack on a previous episode, which I'll talk about, but this is something I know Angie and I both have been looking forward to. So according to WebMD, cavities are the most common chronic disease in children. The mouth, which is the entry point to the rest of the body, is full of bacteria. Some are harmless, but certain germs can cause disease. And experts estimate that more than 50% of kids have cavities in their primary teeth, which is 5 times more common than asthma. Establishing good dental habits like brushing and flossing keeps excess bacteria under control and prevents infections in the mouth and other parts of the body.
Yeah, so consistent dental care is especially important for children who are growing every single day. To establish that care early on, it's important to see a pediatric dentist. Pediatric dentists specialize in diagnosing and treating dental problems in infants, children, and teenagers, and they focus on unique dental issues that can develop in the gums, teeth, and jaw as the body develops and grows. So pediatric dentists provide comprehensive oral health care designed to meet the needs of growing children and teenagers, and what they provide is oral health exams, teeth cleaning and fluoride treatments, diagnosis of early treatment to straighten the teeth or to correct an improper bite, cavity removal, repair of dental injuries like a fractured or displaced tooth, gum disease management to prevent pediatric periodontal disease, and early detection of oral health conditions that could be caused from diabetes or asthma, hay fever, or ADHD. So I might have not covered everything, and there might be more, Dr. Rumack, but we're going to go ahead and introduce you first here, and then we'll dive into all of the details here.
Yeah, and we're so thankful to have an incredible pediatric dentist with us today. Dr. Elena Rumack is among the select few board certified specialists in pediatric dentistry. She's been providing exceptional care to infants, children, adolescents, and those with special needs for many years. Dr. Elena obtained her DDS degree from UCLA and then completed a residency specializing in pediatric dentistry. And she maintains a private practice in Calabasas, California, specializing in pediatric dental care with a subspecialty in tongue and lip tie releases in infants. And she's also currently a clinical instructor and lecturer at the UCLA School of Dentistry. She was a guest of ours, as I said, on a previous episode, which was dedicated to tongue and lip ties, and it was so helpful. So please feel free to give that a listen. It was episode 11. And with that, we thank you so much for joining us again, Dr. Rumack.
Thank you. Thank you for having me here.
Oh, thank you so much. Okay, so let's get started. I think the first basic that we want to start out with is, when should a child first see a dentist?
Okay. Yeah. So, you guys will be surprised at how early the first visit should be. It should be about by the first birthday. And most people are thinking, a lot of babies just have like a couple of teeth the first birthday. Why is that important? So the American Academy of Pediatric Dentistry recommends that your baby have their first visit with a dentist within 6 months of their first tooth eruption, or no later than their first birthday. So the first visit is actually more of establishing a well visit, a dental home for the child, just like you would for the first checkup for an infant, right? Because if there's anything that arises later on, you're not frantically trying to find someone in the last moment. You already know where to go, and you already have a relationship with the doctor or the dentist. So it's very similar to the medical model to establish that dental home early on. And it's not that we're doing like, a thorough cleaning on a baby or anything like that. The first visit is much more like anticipatory guidance, making sure the parents are getting off some good habits, teaching the parents what to look for. And it's more educational for the parents: when to use fluoride, what do we do about, when to stop, using pacifiers, and what happens if there's a dental injury, because a lot of the kids will, fall or bump into things. So a lot of information actually to be covered with the parents, especially first-time parents who really don't know, much about taking care of the teeth. And I don't think, for the most part, most pediatricians will cover those things, of how to care for the mouth and the oral cavity in their first visit with the doctor either. So that's why the first visit, we say first birthday, first dental visit. So that's usually a good guideline. So what happens at this first visit again is like, we're going to, review your history, your family's dental history to see, is this child more at risk of getting cavities or not? And if they're not, then we need to adjust how we're going to take care of their teeth and how often, and when to start using, different types of toothpaste for them as well. So, we also give parents tips on how to brush baby or toddler's teeth. What are some ways to hold them? And, what are some, proper techniques to make sure that you're getting all the teeth and the gums clean when you're at home with them as well. So, and again, as I mentioned, talking a lot about non-nutritive sucking habits, pacifiers, thumb sucking, what does that do to, baby's mouth and teeth, and consequences, and when that should be stopped. So a lot of things that are discussed at that first visit. So yeah, it's important to have them come in the first birthday.
What do you usually tell people about the pacifiers and thumb sucking? When is the time to stop?
Yeah, so I myself, I go through, different types of pacifier with the parents as well. There are some pacifiers that are more detrimental to the growth and development of the jaw versus other ones that are more suited for growth and development. And but most pacifiers should be stopped between the age of 2 to 3, after all the baby teeth have erupted. Yeah. And then once at first they might need it for teething still with the pacifiers, but at about 2.5, all the baby teeth should almost be all the way in. And then at that point, it just truly becomes a habit.
Got it. So you mentioned showing the parent how to brush the child's teeth. Do you recommend that they, at least at the beginning, be the person who's brushing their child's teeth, or are they teaching their child how to do it on their own?
Absolutely. They need to be doing it for their child for a good long time. And I tell parents to brush their child's teeth until they feel like their child can give themselves a bath. That's like age 6, even 7 at that point. So, if the child is very independent, you can definitely supervise them, let them do it first, but then you have to take a turn as well. I explain to parents that actually it's much harder to brush your teeth than to give yourself a bath, because there's a lot more fine motor skills involved. You have to know how to angle the toothbrush. You have to know how to place it in, places that are really hard to reach, rather than just like giving yourself a bath. Those are more gross motor skills. So we need those fine motor skills to develop before the child can take over toothbrushing on their own, which is, for the most part, around the time that the child is able to tie their shoelaces is when they have those fine motor skills coming in.
That's a good tip for me, because I usually I give Hunter the toothbrush and he scrubs himself, and then I go, okay, let's focus on this area, and we'll focus on this area. But I think I'm going to change my habit now so that I'm actually really directing the whole process.
Yeah, and you definitely want to have a turn in your child's mouth. They need to learn that an adult can also go into the mouth, that they will allow an adult in the mouth, because that also makes our job easier when they come in, because if nobody's ever touched them before, it's really hard for someone they don't know to all of a sudden give up that control and let somebody go into the mouth, because the mouth is a very personal space, and it's very invasive if they've never had anybody else go in before. So having an adult, grown-up parent at home go in there, they're already used to other hands being in there.
How do you deal with children who are going to be resistant to you taking a look at their teeth? Or, because it's not like you can reason with a small child, right? So how do you usually handle it?
We usually do it really quickly. We have them sit on mom or dad's lap, and mom and dad are distracting them. And we usually kind of use a toothbrush to kind of put their mouth open so we can take a quick look in there. Nothing is meant to be long and arduous, but we do need to check for cavities, even on kids that aren't cooperative. And I don't expect a 2-year-old to be cooperative. But on the flip side, sometimes when they cry, I can see better. So
Yeah.
Yeah, when we brush my son's teeth, he like chomps down on his toothbrushes. He just like bites the brush like over and over again, right? And so it is important to kind of teach that skill of, that motion of back and forth and getting all the teeth and using different tools. We have this book that talks about the alligator's teeth and like brushing all the teeth of the alligator. And so a lot for them to learn, a lot for them to see.
We do a lot of tell, show, do as well, where we hold a toothbrush, or we are brushing on a model, or I have an alligator.
Oh, there he is.
And then I brush his teeth, and then I show how I brush teeth on the alligator, and then we show how to brush it in the child's mouth. So we do techniques where we kind of ease ourselves in there, not just like jam in there. A lot of tell, show, do, and explanation. Even if they don't quite understand, we try to go through some steps to ease them into it.
Yeah, it's creating that enjoyable experience so that they have positive associations with going to the dentist.
Absolutely.
Do you think that the type of toothbrush matters, or do you have any recommendations for that?
I do. Well, the toothbrushes especially for an infant or toddler, needs to be very soft. In the beginning, we are talking before they have a lot of teeth. I would say, before like the age of 1, we're using like a finger brush that has the soft silicone bristles. There's also like the banana brush that kids really enjoy chewing on. So it's more of like a teething toy, and if they and those silicone bristles can really help massage their gums as they're teething as well, so that that's really helpful for them. As they get the molars in, then we're going to switch over to a more regular traditional toothbrush that has really soft bristles on it.
Okay, great. I think I need to get one of those banana brushes for my 5-month-old right now, because I just saw yesterday she's starting to get a little bit of a tooth peeking through the gum line there. So
I swear by the banana toothbrush. I think that was like my product tip for our tongue tie episode or something, because I think that's what because Hunter likes brushing his teeth. We do it after every meal. I don't know if he just thinks it's dessert or what, but I know that that the banana toothbrush was key in that. So it's like, it's not some scary thing.
Yes. And for kids that are super independent, I know that there are a lot of 2-year-olds like just getting into their terrible twos that they just, won't let go of the toothbrush. They want to do it themselves. I will tell parents to get 2 toothbrushes so they can hold the banana toothbrush and you can hold a regular toothbrush. So, and you're going to take turns. You're going to count to 5. He goes in for 5 and then switches with the parent. The parent goes in for 5. But somehow, because they're still holding onto the brush, they still feel like they have control. So they fight you less on it, rather than if you were to take the toothbrush from him and then go in yourself. So that's a good little tip for kids that are either strong-willed or very independent.
That's a fantastic tip. Yep. Okay, can we talk about toothpaste? This is something
you've been wanting to talk about this forever.
For months. Because I feel like everyone has an opinion. There's so many different things on Instagram, whatever. Okay, so first off, is fluoride safe, and when should you start using it?
Fluoride is absolutely safe to use in the proper amount. So there's been a lot of alarmists out there. There have been some studies that have been done so many years ago on fluoride, where they gave fluoride to experimental rats, and the rats were poisoned because they gave the rats like the same body size amount of the rat. That's how much fluoride they were ingesting into the rats. So of course, having the study just kind of blew fluoride just out of the water. But okay, nobody's going to have that much fluoride on, in their toothpaste ever. So fluoride is in small amounts, is very safe. for infants and for kids, and actually the Academy of Pediatric Dentistry has now stated that you can use fluoride toothpaste as soon as the first tooth erupts. Yeah, if you're using like a very small smear of it, you know. Of course, you know, you want to take into, I mean, there are parents who are concerned and who are, you know, stuck in the, oh, can't do fluoride. In which case I do have suggestions on other non-fluoride toothpaste that are also helpful to decrease dental decay. And one of them being Xylitol non-fluoride toothpaste. So I don't know if you guys heard of Xylitol, but Xylitol is a natural ingredient. It's made from birch trees, and it is a sugar that actually the bacteria that causes cavities, it cannot digest it. So actually over time of usage, it'll decrease the cavity causing bacteria in the child's mouth. So it works a little differently than fluoride. So fluoride makes the enamel stronger, and the xylitol decreases the type of the bacteria that causes cavities. So, you know, for parents who are really concerned, I'll say, go with the xylitol toothpaste. And then as they, you know, get a little bit older, then I will have them start transitioning a little bit to the fluoride, like do the xylitol in the morning and the fluoride at night. So you kind of get the benefits of both. And eventually when they spit out, you can, you know, go over to the fluoride toothpaste if the patient, if the parent's really concerned about fluoride ingestion.
So I'm using a training toothpaste right now, and it says, you know, fluoride free, safe if swallowed. Is that even effective?
Probably there isn't much in there if it's not either decreasing the amount of cavities or causing cavity causing bacteria, or it's not reinforcing the enamel. So it might be just more, you know, washing the teeth off, but, you know, more long-term benefits, I would say probably not as much benefits as the xylitol, the fluoride toothpaste.
Okay, one more question. One more question about fluoride, because I mean, the reason too is I'm sitting here cringing because I had been told, no, you cannot use it until 2 years old. And my in-laws are European, and they said, oh, but Americans have such good teeth and it's because of fluoride. But one of the questions that I have is, when I was nursing, Hunter was a baby. The doctor wanted me to drink tap water because of the fluoride. So I was doing that for a while, and then the tap water in Ventura is so bad that I said, is there any way that I could just not do it and take and give him a supplement, because that was something someone had recommended. But the doctor said that it's better not to give him a supplement, but for me to take the supplement since I'm nursing. We ended up finding nursery water in Target, which is just the water with fluoride, right? And I just mixed that with formula or whatever we were using at the time. What do you recommend out of all of that? Is that good advice?
Yes, I think that's really good advice. I mean, if the water is really hard in Ventura, I mean, of course, it varies in different parts of the country, and you find that it's unpleasant to drink, then yeah, the nursery water is fantastic. That's why it's there. You know, and a lot of parents, they don't want to, you know, mix formula with the tap water because of, you know, other concerns that might be, you know, or that might be contaminated in the water or whatnot. So nursery water is a perfect suggestion, I would say. That's optimally fluoridated water.
And how long should they be using that? Because like we just mixed it in with the formula, and then when we were done, that was it. And he hasn't been getting any fluoride since.
Well, fluoride is, there's a halo effect in fluoride. Fluoride is used in a lot of processed foods as well. So it's not that your child will never get fluoride once they stop drinking fluoride water. You know, processed foods is all made with fluoridated water. You know, baby foods and other, you know, other foods that your child has traces amount of fluoride in it too. So I wouldn't worry about that. I would, you know, if you are very high risk of getting cavities and feel like your child is, then, you know, using a fluoride toothpaste early is also a great way to go.
Thank you. Thank you so much for this.
some of these natural toothpaste that you talked about is Risewell. Is that a good brand, or what's the xylitol brand you recommend? Do you know?
The one that I like is actually the Spry.
Right. Okay.
Yeah, and that's a really good one. You want to look at there are thousands of toothpaste on the market, and I don't know the ingredients of each and every one of those, but you want something where xylitol is in at least the first three ingredients. Yeah.
Okay.
You want it to be not something that's like at the end where it's just a trace amount of it. You do want xylitol. So in this one, the xylitol is after purified water. So that's a xylitol. This is the second ingredient on the tube.
Okay.
So,
and then what about a fluoride toothpaste that you like to use?
A fluoride toothpaste. I'm right now liking the Tom's of Maine, the silly strawberry. I like that because I feel like the flavor is a little bit more mild. It's not so sweet and bubblegummy. So yeah, so that's the one. It's got a mild flavor to it, and it's very effective. And I know it's Tom's itself is pretty clean in general. So it's difficult sometimes to find a clean toothpaste that still has fluoride in it. It's can be a little challenging. Sometimes they just take everything out of it to be totally clean, but it's hard to find that kind of good mix.
Do you have a toothbrush brand that you recommend?
Well, at the office we give out the Oral-B.
Oh, those are cute.
Yeah, so those are really well-made toothbrushes, super soft bristles, and they grind down all the tips of the bristles so that they're nice and rounded and nothing is sharp.
We will link all of these up in our show notes. For you guys that are listening, we have a section on our website that has products we recommend. So if you ever are listening to this and you want to know exactly what we're pointing at or talking about, just go on the website and you can find those easily. So my question next is, how important is the role of diet in oral care? Because we know that sugary foods can cause cavities. But are there any other foods that you advise your patients to eat or even stay away from?
Sugary foods for sure. And actually worse is sticky sugars. So things like gummy fruit snacks, fruit roll-ups, anything that's super sticky and sweet will kind of get lodged into all the little tiny grooves of the teeth. And it's hard to brush off once it gets stuck into those areas or even in between the teeth. So I advise patients to just kind of really limit anything that's sticky or sweet, or eliminate that, or if the child eats it, then brush your teeth right after and drink lots of water. Overconsumption of juice is also a culprit for lots of cavities. So just like pediatricians are recommending only about 4 ounces a day in the sitting. Now the timing of drinking the juice is also important, believe it or not. So you don't want to drink juice in between meals. If you give them that 4 ounces of juice, you want them to have it with a meal. Because as you're eating the meal, you're making a lot of saliva. So everything just kind of washes, the teeth off, and, and make sure it doesn't, stay onto the teeth. Frequency of drinking juice also matters. So if a child that drinks juice sitting at a meal with an open cup and drinks it down, in one sitting during the meal, is fine. But if you have the juice in a bottle and they're sucking on the bottle of juice for throughout the day, that's also not good. So the frequency, how long the juice washes over the teeth is also a consideration, as well as the amount.
How about coconut water? I know that's kind of sweet, but is that the same type of thing as the juice?
No, coconut water is natural sugar, as long as it's not added, sugar's added to it, which I don't believe it is. And coconut water has really good potassium as well. In fact, what I do is I have a lot of teenagers who are athletes who drink Gatorade and sports drinks all the time, because they feel like, they need the electrolytes, after strenuous activity. And I do find that, that's main, dental wise, that may not be the healthiest thing for them. And if they are constantly drinking sports drinks and things like that, I will actually tell them to switch to coconut water, because you have a potassium in the coconut water as well. That's gonna, be a healthier choice for your dentition.
I know that juice is not juice is not juice. It's not like there's a difference between carrot juice versus apple juice. Is there any difference in that as far as the teeth goes, or is it all the same to you?
Check the sugar content of the juice, but in general, apple juices do have, more sugar in it than the vegetable juices, I believe. So, and it's okay to have a little bit of it. You just want to take it, with a meal in an open cup. You don't want to be like, have a baby, sipping on a sippy cup of it all day long. So if it's sippy cups, or whether, they're traveling, and they are, constantly have to have something to sip on, I'll tell the parents, just kind of more like milk and water in the sippy cup, no juices in the sippy cups.
Great
Yeah,
advice. Thank you.
Hard for parents, because I think when they're trying to transition away from the bottle or away from the milk in the bottle or whatever, I think parents sometimes opt for like a half juice, half water ratio or something in the bottle situation, right? And it's kind of weaning off some of these habits, because even milk has a ton of sugar in it,
Yep.
depending on what whole milk or
Yes.
2% milk you're giving your
Yes.
kids. So,
and kids and babies that take a bottle to bed at night, even with milk, can have early childhood caries, where a lot of, there's a lot of cavities on all their front teeth from the milk sitting on their teeth all night long.
right.
So, tapering off with, watering it down, half water, half juice, and then slowly adding more and more water and less juice to kind of, wean the child off is a good idea.
Right. Absolutely. So we talked a little bit about pacifiers and thumb sucking in regards to when to stop them developmentally around, between 2 and 3. But can you talk a little bit about what the impact might be on the palate with the pacifiers and thumb sucking? And I know you've provided some recommendations to us in the past about the specific pacifiers.
Mm-hmm. So the pacifier usage, as I said, we want to stop a pacifier by around age 2 to 3. Thumb sucking is a little bit harder to stop, because you can't really take the thumb away. So, for babies that are really, into their thumbs, I will often ask the parents, I see if you can give them a pacifier instead, because a pacifier is much easier to wean off of than thumb sucking. And, thumb sucking can cause, not only the front teeth to come forward, it can cause an open bite, where if you bite down on the back teeth, your front teeth will be open and won't close, something along those lines. And what happens is, when you have a big gap between the front teeth, that is going to become a possible speech issue later on. These kids, they cannot form a good seal around the front teeth. So certain sounds, like they'll often speak with a lisp. TH sounds, SH sounds are going to be really hard for them to learn until those teeth can be, fixed and the bite can come back to normal. Also causes a really high palate when you're pushing the thumb up into the palate. You want your palate to be wide and shallow. That's proper mid-face development, promotes proper nasal breathing, because the roof of the mouth is just the floor of the nasal cavity. So if you have a pushed up high palate, you also have a narrow nasal cavity. So it makes those kids more prone to congestion, allergy, mouth breathing. And then, a lot of dental crowding later on as well. So yeah, it can change the whole way they breathe, the way they sleep, the way they eat, swallow, speak. So yeah, so having a high palate is definitely, something that we are concerned about.
Switching gears a little bit about to baby teeth. What
Mhm.
age do children start usually losing their baby teeth? And what would you say to people who say that, baby teeth don't really matter since they're just going to fall out anyway?
Right. Yeah. So we get that question a lot because, a lot of kids have cavities on their baby teeth. And some of the parents are like, well, they're going to fall out, so we don't have to fix them. So I would say it depends on when they get those cavities. So if they get them early on, the baby teeth start to fall out at around age 6, the front ones. But the back molars, the baby molars, they don't fall out till sometimes like 12 or 13 years old. So if you have a child that's 5 years old that has cavities on the back molars, well, we've got another 7 years that we need those teeth for. So, and just like permanent teeth, if you get decay, the decay doesn't get smaller. It just gets bigger and bigger and bigger until there's dental pain, and then there's abscess, and then you'll need a root canal and possibly an extraction, which is very traumatic for the child. You can imagine trying to do a root canal on a 5-year-old. Very difficult to do. Oftentimes they, may have to be put to sleep in order for us to do a dental treatment. So, cavities on baby teeth should absolutely be fixed. Say if there's a cavity on the baby tooth and it's going to fall out in a couple months, then we're like, okay, let's just let it fall out on its own. But parents should realize the baby teeth are just as important as the permanent teeth, because they need these teeth right now to be able to eat, to be able to chew, to be able to speak. So it definitely has a function, for your child that's really important until they fall out.
Good advice. Thank you.
Now, what age do you start taking x-rays on kids, and how safe is that?
For the most part, x-rays are really safe now. Most offices will have digital x-rays, not so much the paper x-rays anymore. So, double check with your office, what kind of, x-rays they're using. And we start taking x-rays on children usually between around the age of 4 or 5. So that's when the back molars are touching each other and we can no longer see if there are cavities in between the teeth. And we want to make sure that we don't miss anything during the examination if there's cavities starting in between the teeth. So I would say usually about, for the most part in our office, around 5 years old. I try to, delay it as much as possible. And then, the x-ray machine we use is actually, it's not wall mounted, it's actually handheld. It looks like a hair dryer, and that's how small they make them now. And that is and that machine researches like the lowest radiation on the market. So I just want to make sure everything is safe. And of course we do the lead aprons, thyroid collar, make sure everything is, all parts of the body is protected when we're doing it.
Very good. Very good. So how common would you say it is for dental phobia or anxiety to be present for children? And how do you coach parents kind of through that, or any tips or tricks that you can recommend for kids who do need to see a dentist? And I mean, everybody needs to see a dentist, but maybe somebody who specifically has a problem and also has this dental phobia.
Right. Well, that's why establishing a dental home early is going to be really important, so that they get used to seeing the dentist and they're comfortable with us, by the time, knock on wood, if something happens later on, they already know us, they already trust us. And, building that trust is of vital importance. And that's why we want to see the kids, every 6 months and make sure that, even if it's something that's short and they're scared and we do it really quickly, just the process of, them getting to know us gives us a leg up on, how we can handle that child behaviorally. So having said that, yes, there are going to be kids that will not allow you to do dental procedures, either because just fear, anxiety, what stories that they've heard, or, just kids with special needs. We see a lot of, kids with special needs that, general dentists, don't want to see. So in that case, we do have different modes of sedation to help the child through it. So, one of them being the nitrous oxide, which is the laughing gas, which we use on kids quite often. It doesn't put them to sleep, but it makes them relax. It just kind of keeps their focus off of us. And we have a overhead TV screen, so they're just like happy, chilled out, watching TV. They don't even know what we're doing, basically. So that's probably the best way to do it. And that's how I would say with sedation, light sedation, that's out of all the sedation, like 99% of the time that we're doing, nitrous more often than any other modality. If the nitrous doesn't work for them, they're still, too nervous, we can do an oral sedation where they get a sedative to take orally, and then it just kind of relaxes them a little bit more, and then we use the nitrous. But for kids that are, perhaps just too young and or have special needs that just could not even sit in the chair. So that's when we bring in an anesthesiologist who puts the child to sleep. I mean, I've seen 2-year-olds with 10 cavities, and there's just no way, that we're going to be able to, no matter how much you talk to them, that they're going to be able to get through a procedure like that. So kids that have a lot of, dental decay, or at a young age, special needs, and we're calling in our pediatric anesthesiologist, who comes to our office about once a month or so. And then we line up the cases where the child is actually put to sleep, and we do all the treatment all at the same time.
Okay. You said you use the nitrous oxide, quite often. Are you using that for teeth cleanings as well? Or are we talking about more of like cavity treatments and things like that for when you're using it? Okay.
More cavity treatment. Yeah. Hardly ever with teeth cleaning. I want them, I want them to learn that it's, the point is not to, take all the, fear and anxiety away. I feel like as a dentist, especially as a pediatric dentist, I want to teach them that it is okay for, people to be in their mouths, and to, you can say the word desensitize them, to dental treatment, because, if we do, if we pace things out, if they're so nervous coming in, I'll have them come in the first day and just take a look around the office and then leave with a toy, so they're that nervous about it, and they'll come in and next time, and, I'll space it out a little bit, closer. Come in next time, I will use a toothbrush and just brush it, put it in their mouth, and then they'll leave with a toy, and then next time they'll come, I'll use a Profi cup, so it's really about working and teaching these kids that it's okay, and earning that trust. And that, as a pediatric dentist, I feel like that is the most important part of my job. I'm treating the whole person, not just the tooth. And most pediatric dentists, thankfully, have that in mind when they're treating their kids.
We haven't broached the subject of flossing. And I wanted to know, when do you usually recommend that? And do you have tips? Should it be those ones that are, like the little plastic thing with the floss in it? Do you do it? Can you just talk a little bit about that?
Yeah, I would say in the beginning, I would have the parents do it. Flossing is like, it's a learned skill. It's not easy to do, especially when you're trying to do it in front of the mirror. Everything is like backwards. It's not an easy skill to acquire. So in the beginning, I'll start having parents floss the child's teeth as soon as the back molars are touching each other, which is around the time we take the x-rays, which is around 4, sometimes 3. So, if you see the molars, when they first come in, they might be a little separated, but they'll start to touch each other over time. And that usually is about between 3 and 4. So that's when I'll tell the parents to start flossing them. So flossing them, I would ask parents to do, the string flossing, because they have a little bit more control. But if you feel like your child, could bite on your finger or something like that, then you can use those little floss picks gently. Yeah.
And sometimes those are flavored, I've seen. Or is that okay? Because they
yeah, that's fine. Yeah.
Moving on to when they get a little bit older. Well, actually, first, before that, you had mentioned that they should see the dentist every 6 months. Is that accurate for every age, or do you have a different thing when they're younger?
No, every 6 months is good. If there is, for children who are in braces, who are not, very, proficient at brushing their teeth, or they're not, taking, their time with brushing their teeth, because the braces can hang up a lot of plaque and a lot of debris. And, we usually like to see those patients a little bit more often, actually. I ask parents, to bring them in like every 4 months or so 3 times a year instead of twice a year. And there are patients who just are not very responsible taking care of, braces, and sometimes occasionally I'll have them come every 3 months, so 4 times a year. So it depends on the child.
And when do they start getting braces, and when do you start recommending, I guess, that they see an orthodontist, since that's something that the orthodontist would handle, right?
Usually, right. Yeah. And I know that, a lot of parents are saying like, wow, all these kids are getting braces so early now. And it's true, because we are actually being very proactive with their jaw and growth development. We don't want to wait till it's too late, when, there's certain things that we actually can't fix later on. So we're very proactive with watching the growth and development of the jaws. And we start, if we see problems, we'll start referring patients to the orthodontist at around between age 7 and 9, I would say, when all the front teeth are in. And if there's noticeably, excessive crowding, or there's a big overbite or an underbite, those kind of jaw issues needs to be fixed early. So, they'll go through 2 phases of braces. If there's jaw that needs to, jaw development that needs to, be corrected. So, they will go through a phase where they fix the jaws, and then later on, when all the permanent teeth come in, then they'll go through another set of braces at that point.
Well, that's kind of where I'm all set with questions. But Ange, do you have any other questions that you want to ask her?
Yeah, so they make these little plaque pickers. Is that something that you recommend for little kids, or is that a little bit too invasive on the gums?
Is that like the little flossers, or are they like
Yeah,
little?
not the little flossers with the floss in them, but like the little teeny brushes you can stick in between.
Oh, the endodental. Yeah, I wouldn't recommend
Yep.
that on baby teeth.
No. At what age would that be appropriate, or do you wait until you're an adult, or?
Yeah, I would wait till at least teenager years, perhaps, with there's, with braces, and it's very difficult to floss. So those
Yeah.
interdental brushes would be better, because
Okay.
you can't, with a wire there, it's really hard to floss in between.
Okay.
But yeah, I wouldn't use those, because, toddlers are wiggly, it's hard to kind of be precise and poke things in between their gums, and you can end up, causing some injuries on them if you're not careful. And most toddlers will not sit still very well.
No. Yeah, I had our dentist say, just focus on 3 teeth at a time when you're flossing, just 1, 2, 3, and then have them try it or whatever. So, I thought that was a good tip.
Yeah. Make it fun, make them, be a part of it. So, and make it fast and efficient, I would say.
Absolutely. So any other encouragement or advice that you would provide to parents to just encourage them with dental care in their kids?
Consistency and keeping it on a regular schedule. Toddlers and babies love schedules. So make sure you do it at the same time every night as part of the bedtime routine, part of the waking up routine, making sure you're brushing, them twice a day, and keeping and flossing them at night, for the toddlers that are, appropriate to floss. And then making sure you're giving them really healthy foods, calcium, making sure that they have dairy in their diet. If they're allergic to dairy, then go with green leafy vegetables that have calcium in it. And discuss with your pediatrician if any, vitamins, extra vitamins or supplements are needed. But for the most part, the water in California is pretty optimally fluoridated. So we don't often prescribe fluoride supplements to the children anymore. Stay away from sweet, sticky things, and never let your child go to bed with a bottle at night where the juice or the milk is constantly washing over their teeth, because baby teeth are actually have really soft enamel, so they can get kids can get decayed very, very easily. I don't often see, as a pediatric dentist, I don't often see kids come in with like one single cavity, like with an adult. Adults will go in and have like one cavity. When kids come in, they have cavities. It's usually like 6 to 8 all at the same time, and it's traumatic to have to break the news to the parents, and to have to then deal with the consequences later on. So the best mode of strategy is prevention, 100%. Making sure you're brushing them twice a day, flossing them, cleaning the teeth. I tell parents, flossing and cleaning your teeth, brushing your teeth should be the last thing you do at night. Don't drink anything after that except for water. So you don't want anything in their mouth at night when they're sleeping. And then stay away from anything that's sweet and sticky, and just, use common sense and be healthy.
So helpful.
Yeah.
So helpful.
Oh,
Looking forward to this episode so much, and I'm so appreciative. Yeah, that's a lot of really great advice, and
yeah, it's a lot of information, huh?
yeah, and I think that it's really going to help parents out there. Even the questions they didn't know that they had. Certain things are coming up in this topic, going, oh, I've been doing that wrong, and this is so helpful. So very appreciative. So at the end of every episode, we always share either a product or a tip or a recommendation of anything that has helped us personally throughout our motherhood journey. And Ange, do you want to go ahead and share one today?
Yeah, so lately I've been using those Frida gel packs that they make because our daughter had a low-grade fever for a little bit, and it's just like a sticky gel pack that I cut in half, and then I put it on her forehead, and it's nice and cooling and makes her feel a little bit better. And my son thought it was cool, so he wanted to wear some too. So that's my tip for today.
That's awesome. And Dr. Rumack, you've given us so many great tips. I don't know if there's anything else that you wanted to add to it. I don't want to miss the opportunity.
I will add one thing, if you don't mind, because we were on that Xylitol, because I'm really liking the Xylitol for the babies, and I think moms don't often know that product exists for the babies out there. So the Xylitol toothpaste is fantastic. It's safe to swallow. It helps to decrease the bacteria that causes cavities in their mouth. So once the bacteria is lowered that causes cavities, and the good bacteria will take over. So that kind of builds over time. So they'll get less cavities over time as well. For babies that you can't really use a toothbrush yet, or the moms feel like they want to use their finger, there is also this brand called Spiffies. They are little tooth tissues, tooth wipes that you can wrap around your finger, and you can use that to brush, to clean the baby's mouth and gums before they even have teeth, after feedings at night and in the morning when they wake up. So just wipe off the gums and the cheeks and with these little spiffy wipes, and those have xylitol in them as well.
I see. It says grape flavor. Like I said, everyone who's listening, we will link these up so that anything that Dr. Rumack is holding up to show us, we will have on there as a link. Can I ask you one more question about dentistry? Sorry. Yeah. How old are they when they start spitting out the toothpaste? Because at this point he's still swallowing.
Yeah, you usually around boys are a little bit later with most things. I would say usually around 3 years old or something like that. Okay. Some kids are earlier. There's no study on this, but for me, it seems to be right when they're potty training. It seems to they seem to get it. It seems to kind of click, and then they'll start to spit. And one good suggestion is when you're teaching them to spit, what you can do is have them. Parents to put some rubber duckies around all over them and see if they can spit on them and give duckies a shower. So that way it's kind of a fun activity and it doesn't make a whole mess of your bathroom.
Love that. I love that. My son is going to do that tonight with me.
Awesome.
Real quick, I have one more question too. What about Oragel?
Yeah, I meant to ask that.
Oragel. It's a bit of a hit or miss. Are you talking about in relation to teething, right?
Yeah, should we use Oragel and how much can you use, and is there a brand that's better? Because I try to use the more natural ones versus ones that might not be so natural.
For babies, I don't love the oral gel. The oral gel it's very similar to the topical anesthesia that we put in the mouth before we give the shot. So
Yeah.
it numbs the gums, but what happens is the kids, they always lick the area and then their tongue gets numb and then everything is numb and now they're pissed. And now they're irritated because they can't feel their tongue and everything feels weird.
Right.
For babies, what I like is actually, I have the product too, I'll give it to you, is an organic clove oil for teething.
Right.
Yeah, I really like that. Have you guys heard of that one?
You talked about that in the tongue tie episode for the
Yeah.
healing of the wound, I believe, too.
Yeah,
Okay.
to help kind of with discomfort on the wound after tongue tie healing.
Okay.
So that's great for teething as well. And I'll give you guys the products. I can link it up on there as well.
Awesome.
Yeah, and I think the Orajel toothpaste you kind of already discussed, because that's the one that you said probably doesn't have much benefit to it. So that's when I was thinking about the Orajel. There's the teething gel, but then there's also the toothpaste, and I think I'm going to switch brands. Sorry.
Yeah, you want something, toothpaste lasts more, so less coloring, less additives, and more organic is the way to go, but still with fluoride or xylitol in it. Yeah,
Excellent.
yeah. And I'm also going to give you the recommendations. Yeah, I have all these products now. You made me think about the pacifier. So right now I'm really liking the pacifier called the Ninny pacifier. NINNI. It was made by two moms, and they're an up and coming company, and they are doing really, really well with the whole oral community here. And it's a pacifier that does not really cause changes in the jaw and the bite of the baby with prolonged usage. So I'm really liking that pacifier right now.
Yeah, you had said in the previous episode that the hospitals give a harder pacifier, so everyone kind of is accustomed to that, but it can do such damage.
Yeah, over time over time with prolonged use, absolutely. Yeah.
Thank you. So my tip is completely off topic. It's not a product, it's not a resource, but this probably sounds extremely random. But so I've been working out lately, and I don't like to go to the gym. I'm not a gym rat in any way. I just like to move. To me, working out is movement. Exercise is just movement. I love to dance. And I found this YouTube channel called Dance with Deepti. And it's Bollywood dancing. Okay. And the first time I found it, it's like 22 million views. I'll check this out. Okay. Oh my gosh. The joy it is bringing to my life. I'm having so much fun because this music is so fabulous. Hunter's just seeing me dance around the house. I'm doing this, I'm working out. And I just really wanted people to know about it because it's so fabulous and it's bringing my quality of life even up higher. So just wanted moms to know that, like, hey, even if you have 15 minutes and you can just like put on some great music to dance to, like, this is a good place. So
yeah.
Yes. So fun. Kids love to dance, so that's super healthy. Yay.
I just want to thank our listeners for being here today with us. If you would like to get any more information on this topic or any of the other topics that we cover, please visit our social media. We are at Informed Mom Podcast. Online, we are www.informed-mom.com. And if there's also a topic that you would like to learn more about, please reach out and let us know. Because we'd like to cover as many topics as we can to help moms along their journey. And if you're personally struggling, reach out and say hello, because we are a part of your village, okay? And with that, you guys all have a great day, and thank you so much for listening.